So, case study number 2, displaced fracture of the femoral neck. While walking home from the train station, M.A., a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her right thigh. A radiograph showed a displaced left femoral head neck fracture. M.A. was prepared for surgery and when given a preoperative injection for of an analgesic to relieve her pain. Intraoperatively, she was given spinal anesthesia and positioned on an operating room table with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip in abduction, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case study 2-2, intratrochanteric fracture. AR, age 88, slipped on a wet grass and fell while gardening in his backyard. His neighbor was able to help him to a standing position and called for an ambulance. AR had excruciating pain in his right leg, which was externally rotated, slightly shorter than the left leg, and adducted. Preoperative radiographs showed a non-displaced right intertrochanteric fracture. Intraoperatively, Mr. R was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with a compressed screw and side plate with screws. His post-operative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in his leg. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living such as personal hygiene, dressing, eating, ambulating, and toileting. Write the word for the case histories that means the same as each of the following. Number 1, replacement of half of the joint component is open reduction. Number 2, substances that act against microorganisms, antibiotics. Number 3, in a position away from the midline of the body is lateral. Number 4, position toward the midline of the body is medial. Identify and define the prefix of the following words. Number 5, displace and dislocate. The prefix is dis, meaning apart or away. Number 6, replacement and rehabilitation. Prefix is re, meaning again. Number 7, avascular. The prefix is a, meaning without. Anesthesia and analgesic. Ana, which means against. Number 9, orthopedic. Ortho would be the prefix meaning straight or correct. Number 7, externally would be ex meaning outside. Number 11, bipolar. Bi would be the prefix meaning to. Number 12, unremarkable. The prefix would be un meaning without. Fill in the blank. Number 13, the adjective for the operative time span for decision for surgery to placement on the operating table is preoperative. Number 14, the adjective for the operative time span for placement on the operating room table until transferred to post-anesthesia recovery unit or intensive care unit is intraoperative. And number 15, the adjective for the operative time span from admission to post-anesthesia is postoperative.